Hello friends, I am Dr. Viswesvaran and I am currently working as a consultant interventional pulmonology and sleep medicine specialist at Yashoda Hospitals, Malakpet in Hyderabad. So today I will be briefing you about few of the facts which you should know about the Omicron and how to protect yourself from this variant of COVID-19 pandemic virus. So we all know that this Omicron virus started in South Africa and right now we are in the third wave of COVID-19 pandemic, and most of the infections that we get in our routine day-to-day practice are secondary to this Omicron variant. So this Omicron virus has got a unique genetic mutation, which means there are some changes in the characteristic of this virus, because of which this virus is capable of spreading more rapidly in comparison to your Delta variant. So let's say if I get infected, I am at 4 times higher capability of transmitting this infection to my other members in comparison to the Delta variant. But the good point is the severity is also somewhat lesser in comparison to the Delta variant. Having said that, it should not be taken lightly just like a common cold, because we do see few of the patients, especially who are elderly or patients who are taking some immunosuppressed medications or patients having underlying health issues getting admitted to wards and ICUs, and few of them even require oxygen and ventilatory assistance. So when you should suspect you have a Omicron variant. So unlike your Delta wave, which affected a few subset of population, this Omicron is capable of affecting people across all age groups, right from children even to adults. So any person in your family, if they suffer from fever or running nose, nasal block or headache, sore throat or body weakness, or even for that matter vomiting or diarrhea, then probably you are suspected to have a Omicron variant of COVID-19. So when you have any of these symptoms or a combination of these symptoms, then the first thing what you have to do is to protect your family members. So you need to isolate yourself. So once you isolate yourself, then you have 2 different types of tests by which you can find out whether you are infected with this COVID-19 infection or not. The first is the point of care test or the self-testing, which is the rapid antigen testing. This rapid antigen testing is also found to be effective in identifying whether you are infected with a COVID-19 infection or not. But however, it cannot give you a certainty whether you are affected with a particular variant of this COVID-19 infection, whether it is a Delta variant or an Omicron variant. So once you turn positive with a rapid antigen testing, there is no need to redo an RT-PCR as per the government advisory, and you can contact your healthcare professional and self-isolate yourself. In case if you are doing the RT-PCR testing, then we have a multitude of methods of doing this RT-PCR testing. Few tests can identify whether you are infected with this Omicron variant or not. So once an RT-PCR testing has been done, there is no need to repeat an RT-PCR testing on a serial basis, or even a repeat RT-PCR is not required once you have finished the duration of the quarantine or you are discharged from a COVID-19 healthcare facility. So what can you expect when you reach a hospital? Generally, most of this current Omicron variant are self-limiting symptoms, and your healthcare professional may advise you to take some symptomatic medication like a paracetamol for fever, and he may advise you to keep yourselves well hydrated, and he may give few symptomatic treatment for cough and breathing problem. But however, if you fall under the high risk category or you are a person with underlying health issues, then your healthcare professional may ask you to use the monoclonal antibodies if deemed necessary. And in case if your healthcare professional finds that you are in need of oxygen or other advanced life support, he may ask you for an admission, and once you are admitted, he may start you on other antiviral medications as well. However, injudicious self-administration of these antiviral medication is strictly not advised and should be deferred, because it can have a negative impact on your health. So once you are treated either at home or in the healthcare facility and you started showing signs of improvement, or if you have finished the quarantine period of 7 days as advised by the government of India following the detection of the COVID-19 variant, then you need not repeat an RT-PCR and you can step back into your routine life. However, there are few patients who may continue to experience the side effects of this COVID-19 infection, like few may continue to suffer from persistent body ache or sore throat, which eventually goes off with time. And one important thing that we all must take into consideration is we need to get ourselves vaccinated with at least 2 doses of the COVID-19 vaccination, because this is the only available means by which we can prevent a serious forms of the COVID-19 infection. And if we are eligible, then we should also get our booster doses of vaccination. And currently the booster dose of vaccination is advised for people who are in the frontline workers or the healthcare workers, or people who have underlying health related issues, or people who are in the elderly population. But however, in near future, we may see the role of these booster doses being practiced in other population as well. And with respect to the children and the pregnant women, they need to be extra cautious, because these are the populations who are more vulnerable. And in case if you find symptoms of COVID-19 infection in them, then do consult your healthcare professional immediately. Thank you.